And that's step one, is to focus on heart disease. Go to your primary care doc and say, I want to wage a war on my body to find out where I'm at. And if I have it, I want to wage a war to halt and prevent it and shrink it. And I want to start treating my body like the concern you have about cancer. I want my concern. The second thing you need to know is that heart disease starts young. And we need to be teaching people to start young. You know, if we saw an 18-year-old smoking, and if you had a child that was 18-year-old smoking, you might talk to them about their risk of lung cancer. And yes, that might take a long time to develop. If you saw a young person eating terribly and obese, you might talk to them about their risk of colon cancer, because colon cancer is growing in risk in the young people. But heart disease is even worse than that. This is one very famous series of studies of Korean casualties, Americans who were 20, 21, 22, where the amount of atherosclerosis on their autopsy at age 20, 21, 22, 23 was extremely high. And it was also true in Vietnam and the Iraq incursions. Sometimes these were small plaques, sometimes these were severe plaques in young people. So if you have children, it doesn't matter if they're 7, 17, or 27. It's the time to have a heart-to-heart with them, literally, about their diet, their weight, their blood pressure, their sleep patterns, and their fitness program, because they are developing atherosclerosis more likely than not. When you look to the left, and a little dated, but nothing really has changed, the causes of death in the United States, even 24 years ago, were number one, heart disease, and number two, cancer. But this insightful series of studies that were published showed that we can go beyond just saying that. And we should say right now, the number one cause of heart disease and the number one cause of death in the United States is actually lifestyle factors, followed closely by genetic factors. But we can't control, we can measure, but we can't control our lifestyle, our genetic factors, but we can control. So smoking, poor diet, and physical inactivity, sitting, either by a job that requires to sit or just a lack of attention to fitness, are the top three 85% causes of death in the United States. And we know if we can teach young people, middle-aged people, and the elderly not to smoke, to eat whole food, largely or exclusively plant diets, cooked at home, watching salt intake, and get people moving, standing, treadmills, walks, and more intense fitness, we can make a major inroad on preventing the disease at its start. Perhaps you know this slide. Dr. Dean Ornish is famous for this slide. Others use it. But this is the American medical system. The sink is on, the sink is overflowing and spilling on the floor. And us doctors and nurses are mopping up the heart attack, the stroke. We are using stents, we're using bypass, we're using defibrillators. But what's going on with the sink? Nobody's paying attention to those 85% of factors that are lifestyle controllable: the smoking, the weight, the sleep, the nutrition, the vitamin levels, and we can measure genetics. Would you like to know if your genetic risk was high, so you had to really focus even more on prevention? Would you like to know if your genetic risk is lower? These are widely available nowadays. Perhaps in the Q&A, you can ask me about that. So we do know that roughly 85% of atherosclerotic heart disease may be preventable if we start early enough and we get excited enough and talk about this as a war on heart disease, equivalent to the war on cancer. We also know that while you're working on preventing heart disease, you'll reduce your risk of type 2 diabetes, cancer, dementia, obesity, arthritis, and other conditions. Things go together. That's the functional medicine network that we proudly attack. Do we actually know that we can prevent so many heart attacks? These are two studies now about a decade old from Europe, but they assessed in nearly 40,000 men and women, those people that avoided smoking, exercised 30 to 40 minutes a day, ate a higher than average number of servings of fruits and vegetables a day, slept more than 7 hours, not less than 5 hours, And actually, one of the benefits in this study, quite controversial, was people who did enjoy a few glasses of wine a week. And when they found people that did all 5 bullet points and they followed them over time, they had 85% lower risk of heart attacks than people that ignored these simple lifestyle factors. Now, I'm not encouraging you to drink a glass of wine. That's totally your deal. But I am encouraging you not to smoke, to walk every day, to eat a large number of fruit and vegetable servings, and to focus on good sleep. I was in bed 9 hours last night, probably slept about 8, and that's pretty typical. So, how are we going to start kicking the ass of heart disease? And it has to start with a philosophy I call test, not guess. But it's not new, it's old. And 400 years ago, this English physician, and I apologize, the word person should be about half an inch higher on the slide. Somehow in the translation, it got moved down. But this famous English physician, Thomas Sydenham, said, a man is as old as his arteries. And let's just substitute the word a person is as old as his or her arteries or their arteries. But do you know, you the audience who have partners and spouses and brothers and sisters and parents and children, do all of you know how old your arteries are? Because if you don't, you're an amateur. And if you actually know how old your arteries are, I'm proud of you, but you're a professional in this game of kicking heart disease in the ass. One of the problems is pointed out in this meme slide. If coronary artery disease was attacking your face rather than your heart arteries, you'd do something about it, and you would. But we're talking about a disease that is silent. It's easy to detect. I do it every day in people of every age, but it is silent and we ignore it and we don't get excited about it and we don't think about it like we think about cancer risk. So there has been an effort for 25 years to detect heart disease early, because the awful truth is doctors are not wonderful when they're sitting with a patient at being precise at assessing if a person has heart disease and is going to perhaps die early, or doesn't have heart disease to the point that it's going to cause them to die early. Whoever would have predicted that Winston Churchill and his size and smoking capacity and diet would live to 91, when a very famous runner, some of you are old enough to remember Jim Fixx in the Book of Running in the 1970s, died of a massive heart attack at age 53, despite being the guy who pretty much put marathon running on the map in the United States. Never would have predicted it. Now, it's rumored that Jim Fixx had an extremely high cholesterol, probably genetic, and a very poor diet. And maybe somebody could have got to him. And I hear that people did talk to him about it, but he would say, I can out-exercise my diet, don't worry. But didn't work out for him. And there are people watching this presentation right now that have the problem that the black arrow on this heart catheterization angiogram picture is pointing to, which is we call it a lesion or a narrowing or a stenosis of a heart artery. In this case, the widowmaker proximal left anterior descending artery. And believe it or not, your artery can be narrowed so tight and you don't have symptoms, or you have subtle symptoms. Perhaps you're just a little winded, a little tired, a little burning in the chest you attribute to heartburn or fatigue. But this can kill a person, within 6 minutes of a cardiac arrest. And it does that over 600,000 times a year in the United States, according to the statistics I presented. Do you know if you have this problem? Wouldn't you want to know, even though it'd be bad news? Wouldn't you want to roll the dice in your favor and attack this problem with chemotherapy, surgery, and lifestyle bombs all over the place? So there are some interesting clues beyond just having a heart catheterization. There's some data that people that go bald on the top of their head early in life may have some premature aging of their arteries. It's similarly around the temples. And there's actually some data, scientific studies, that having salt and pepper, gray hair early in life is a sign of oxidative stress and imbalance and could be a clue that the heart arteries are also under stress. Certainly, if you have yellow deposits around your eyelids, you can have a genetic cholesterol disorder and get your blood checked. And then there's the strange one called the earlobe crease, but that comes up over and over. I have to use my digital friend, Steven Spielberg. I've never met him. But if you look at his earlobe and that deep groove, he didn't have that when he was a bar mitzvah boy of 13, I can guarantee you. It accumulates over time. He doesn't wear heavy earrings that dragged his ear down. But in the 1970s, a doctor in New York published a paper that when I see a earlobe crease, I tend to pick up heart disease in my patients. And when I see smooth earlobes that don't have a crease, I tend to see people that don't have heart disease. And it was celebrated as an interesting advance. It was forgotten, but in the past 10 or 15 years, there's a number of studies that have confirmed that if you have a deep earlobe crease, get your heart checked. It's not going to prove to be bad news for everybody. It's about 70% accurate. And there are actually people that schedule an appointment to see me in my clinic solely because they looked in the mirror, and it's usually both ears, and they won't go away over time as far as we know, but they weren't there if you look at a picture 20 years before. Another very important clue, hopefully everybody knows, but boy, everybody in my clinic gets asked about, is erectile dysfunction, the canary in the coal mine. The fact that a man having difficulties in sexual performance, not really libido, but sustaining erections, may have clogged arteries or atherosclerosis below the belly button, but may also have clogged arteries and atherosclerosis above the belly button in the heart. And all men with erectile dysfunction should get a very aggressive check of their heart arteries, as well as being considered for testosterone replacement therapy, if appropriate, or lifestyle measures and beets and greens, and if needed, the erectile dysfunction drugs, Cialis and Viagra, which increasingly are viewed as very safe. And recently, both Cialis and Viagra have been shown to possibly lower the risk of dementia, if you didn't read that recently, and maybe even prolong life. So